Good afternoon, ladies and gentlemen. My name is Loan, and today we have May, Rubit, Nilo, and Tao, and we'll be presenting to you our quality improvement project. The objective of our quality improvement project is to educate nurses and patients about the importance of the vaccination, address the concerns that patients might have with the vaccinations, and hopefully provide an educational tool that will result in increased vaccination rates of patients at Valley Hospital. So identifying the problem was low influenza vaccine rates throughout the hospital. As nursing students, we know how important flu vaccines are to our own health. In fact, every year we're required to stay up to date with vaccines for our safety while we are in nursing school. While we understand the preventative care implications of influenza vaccines as student nurses, we recognize through observation through clinicals that influenza vaccination distribution through the hospital is low. This is despite the fact that the hospital does practice asking patients upon admissions if they would like the vaccine during their stay. This led us to create a survey to get a pulse of why patients are or are not getting the vaccine. Look up some evidence-based practice and present this information to try and improve vaccinations rates for influenza with patients at this hospital. Now, before going into the survey of results, did you know that Healthy People 2020 has a goal for 80% influenza rates in adults under 65 years old and 90% of adults over 65 years old? This is one reason why we wanted to see how the hospital was doing compared to that goal. Now, to talk about our survey and how we administered it, each student had a nurse preceptor, and each preceptor was assigned 6 patients. Of those 30 patients, we were able to survey 24 of them. Here are the statistics. While we know our sample size is small, it still provides some interesting insights. We were able to gather 24 patients surveys, 16 men and 8 women. When it came to refusing the vaccine, it was offered to them, more men declined. Less than half of the patients already had the flu shot. But for the people that didn't have it, almost 30% said they wanted it. It was as simple as offering it to them. Here are some more interesting statistics from our survey. For patients that were less than 60 years old, 70% of them had or wanted the vaccine. But for patients who were 60 years old or older, only 40% had or wanted the vaccine. This is really important because our research notes that the elderly is more vulnerable to infections and complications. And last but not least, like we started earlier, more men refuse the vaccines compared to women. And in our survey, we also wanted to find out why people didn't get the vaccine. In this cloud, we can see that there are 3 top responses. They didn't ever want to get sick. They don't need the vaccine. Another one is that they didn't want it because they already got the flu shot, because they got sick. And the last concern that came from surveys was that people were unaware what the flu shot was or what was in it, which is why they did not want it. We believe that what the patient responses show us is that there's a lack of education regarding benefits of influenza vaccination. This is where, as nurses, we can bridge this gap. The following review of literature will help form a basis of important knowledge to help nurses want to educate their patients on the benefits of influenza vaccine.
Where people are getting vaccinated. What you're looking at now is a word cloud of the patient that did get the vaccine. We were able to ask where they got it. The size of the word in the cloud represents how often patient gave that response. As you can see, most of them replied that they got their shot from their primary care physician. Other responses included during dialysis or at their rehab center. A study shows that giving the flu shot is the most effective method of preventing the flu. The vaccination, adults hospitalized decreased by 71.1%. For adults older than 50 years old, hospitalization decreased by 76.8%. Pneumococcal polysaccharide vaccine, 90% of annual deaths with underlying pneumonia and flu are in people 65 years old or older. Pneumonia infection rise and fall with the influenza season. Best practice is to deliver pneumococcal vaccine with the influenza vaccine.
The elderly are one population that we are really concerned about since influenza may result in long-term decline in major physical functions within the frail elderly population. Over the past 31 flu seasons, 90% of annual deaths from people older than 65 had underlying pneumonia and flu complications. Patients with cardiovascular or lung disease have decreased hospitalization with flu shots, and other populations of interest include diabetes patients, cardiovascular patients, and liver patients. One study did show that cardiovascular patients and lung disease patients did show a decrease in hospitalization rates when they also got the flu vaccine. The next research we want to share found that one reason why there are low vaccination rates can be attributed to the low vaccination rate among healthcare providers. The study encourages healthcare providers to increase their education about the importance and benefits of vaccination. They hope that their own compliance will help them recommend, educate, and improve vaccination rates of their patients. We were able to do a quick survey of the staff members of the hospital, which includes the nurses, EMS, CNAs, therapists, PAs, and physicians at one of our clinical days, and of the 32, only one nurse said that they hadn't gotten the flu vaccine just yet.
Next, we want to talk about some evidence-based practices that worked to improve vaccination rates. So improvements with the use of the EHR and EMR. Based on Patel et al.'s peer review, they found that by utilizing the EHR to identify clients eligible for vaccination during the clinic visit and upon assessing the patient chart, they got prompts to actively choose to either accept or cancel the order for this flu vaccine. This means that tracking the active choice intervention in the study was associated with a significant increase in influenza vaccination rates when compared to a control group over time. EHR tracking is a scalable approach for optimizing medical decision-making and improving influenza vaccination rates.
According to Squirrel Knight, the electronic immunization screening assessment form encouraged continuity of care, and whoever completed the assessment would administer the vaccine. The vaccine would be indicated after patient consent was received. Electronic medical record use helped prevent previously missed opportunities, and the staff felt more confident in administering vaccines when they were the ones completing the screening tool at admission with the patient. Those who refused the vaccine or already received the vaccine did not count as missed opportunities, but those who were screened inappropriately or did not receive the vaccine when indicated were counted as failures.
Improvements in vaccination rates were found with having more frequent physician recommendations. Coverage increased also with having increased age and increasing numbers of comorbidities related to more frequent contacts with your medical providers and increasing that opportunity to be offered that vaccination. So some comparisons that we made based from our studies and the hospital were that the hospital does utilize a screening assessment upon patient admission, but some of the things that they do not do include pneumococcal vaccinations along with the influenza vaccine. They don't track why patients decline the vaccination. They also don't provide an educational tool for their patients and frequently don't recommend the vaccine.
So for our pamphlet to help educate patients, we respond to a few questions. Why is it important for me to get my flu shot? Flu is highly contagious and can be passed with cough or sneeze. It can cause symptoms like fever, chills, cough, sore throat, runny nose, and stuffy nose, muscle or body aches. Infants and older population can be more vulnerable and can cause death. Studies have also shown a 71.8% decrease in hospitalization with flu by getting vaccinated. I got my flu shot last year, so why do I need it again? Flu virus is tricky and is always mutating, making our bodies not recognize it. Scientists use previous strains to predict what new virus will look like and reformulate vaccine based on predictions. Can the flu shot make me sick? The answer is no. Flu shot has inactive viral particles that cannot make you sick. It takes 2 to 3 weeks before vaccine can fully work. So within that time, if you were to get infected with a light influenza virus or cold virus, you may get sick. If everyone else gets vaccinated, do I still need to get vaccinated? Yes. In 2009, it was reported that 395,000 people died. Last year, 56,000 people died of flu. This number can be reduced by simply getting vaccinated. I am healthy and I never got the flu, so I don't need to get vaccinated. You can carry the virus before showing symptoms, so you can spread the flu to others that are at high risk of contacting it. Protect yourself, your family, and those around you, and get vaccinated. It is safe to get flu vaccine when I'm pregnant, yet it is safe to receive flu shot and not the nasal spray flu vaccine because it contains live particles. The vaccine can protect you and baby for several months after birth. I am allergic to eggs. Does that mean I'm allergic to the flu vaccine? Yes, allergic reaction can happen, but they occur very rarely with flu vaccine in the US today. A recent study found the rate of anaphylaxis after all vaccine is 1.3 per million vaccine dose given. I hate needles. Nasal spray vaccine is the alternative to the flu shot without needles. Is effective, just like the flu shot, and keep you healthy and doing throughout the sick season. So here we're gonna conclude our presentation.
Through EMR tracking, frequent recommendations, and education,
We can help increase vaccination rates
and decrease complications and hospitalizations related to influenza.
thus improving the health outcomes for all of our patients.
This concludes our quality improvement project. Thank you for all your time and have a great day.
Yay.